does not mean that the more you wash your face, the less acne you'll have. Hindi rin naman. Yung recommendation lang, it's 2 times a day or at the most 3 times a day.
Hey everyone, I'm Dr. Kristine Alba Kiat, and this is Chat with Peds, where I interview experts in the field in order to empower you and give you the confidence to raise happy and healthy kids. My guest is a colleague and a good friend, Dr. Louella Ramos. She is a board certified dermatologist of the Philippine Dermatological Society, and she's also the chairman at Southern Isabela Medical Center, Department of Dermatology and Venereology. She's a wonderful resource for any questions I have about my patient's skin and my skin as well. Join me as I welcome Doc Ola. Hi, Doc.
Hi, Teen, and hi everyone who's watching the YouTube channel of Dr. Kristine Kiat.
Yeah,
Thank you for inviting me. It's an
yeah.
honor to be part of your show.
You're so busy. It's so hard to catch you, Doc. So I'm so glad
I
matutuloy na tayo.
see.
Now let's go to the last part where Doc Ola will bust myths about acne. So, Doc, first question. Eating junk food causes acne. Is it true?
No, eating junk food doesn't cause acne, but the foods that can trigger acne would actually those that contains dairy. It has been shown in studies that dairy-containing products. So, usually yung pasyente, sabi nila, hindi ako uminom ng gatas, hindi po ako mahilig sa cheese, pero araw-araw naka-milk tea. Oh, so talagang maka-trigger talaga. So, yun yung mga kumisa tinatanong na, or other dairy-containing food.
Okay. Next myth. My father had acne. I will get acne too?
Yes, yung
Okay.
pwedeng mamana mo ang acne, but of course, it's not a uh, 100% rule na magkakaroon ka. But it could be that mamamana mo yung pagkakaroon ng acne. Like if your father or your parents, growing up, they had acne. So yung pilosebaceous unit, the anatomy and physiology of their skin, namana mo. So, well, lucky for you.
Oh,
Yes, you can have acne.
so that's
But
true.
it does not mean that if they had, you will also have acne. Pwedeng hindi, pwedeng oo.
Okay. Next, getting facials will clear up acne?
Uh, Kailangan ba yes or no lang?
Hindi,
Sige,
up to you.
it could help. It could help, but it is not the only treatment that you need. In fact, if the
Okay.
facial is not done correctly, it could in fact trigger your acne. Diba? Like we have facial salons, prick lang sila ng prick. They don't know which of the lesions to prick. So instead na nagki-clear up, actually nawo-worsen pa siya.
Oh.
So again, yes, if the facial is not done correctly, it could trigger your acne.
All right, so be careful. Next question. I can't use makeup if I have acne. Is this a myth?
Uh, Yes, you can actually use makeup, but make sure that the products you're gonna put on your face when you're treating your acne are non-comedogenic so that it does not add to the weight of the products that are on your skin. Kasi di ba remember yung ating pathophysiology, if you put more plug or the products will just obstruct the pilosebaceous unit, it's gonna cause more acne. So, yes, of course you can. Just make sure that these are non-comedogenic.
All right. Next question. Scrubbing the face will get rid of the dirt and oil.
Yes, it could get rid of the dirt and the oil, but scrubbing so often could trigger acne,
Oh,
actually.
really?
Yes, there's this study, I'm sorry, I could not cite the specific journal, that they scrub the recommendation is you can use scrub on your face just once a week
Okay.
para to take off lang the ano. Pero scrubbing daily, especially if you're using strong ones that has salicylic, kasi yun yung contents nun usually could actually cause more damage. So, you can scrub but not as much as possible, not daily.
Okay, got it. How about the next one? Expensive acne products work better than cheaper ones.
Ah. Well, actually, the acne medications in general are quite expensive compared to other creams, 'di ba? Kaya nga yung mga online when they're a lot cheaper.
Mm-hmm.
Pero siguro that's true kasi when they're a lot cheaper, why are they cheaper? Kasi hindi yan dumaan sa FDA, hindi yan of quality, of standard medication. But the thing about topical medications or acne meds in general is that whether it's expensive or not, its use only becomes more effective if you properly use it as prescribed by your doctor. So it could be that more expensive medications are more effective, but if you're not using it, so it depends on the user also. If you're not using it properly, complying to sometimes when I say compliance, it's not just yung mga tamad magpahid. Meron din yung overzealous sa pagpapahid. Hindi rin tama po yun.
Okay. Okay. So, yung kung ano lang yung direction. Yes.
Yes, if it's you just said that you just apply it twice a day or just once a day at night, dapat dun lang po tayo susunod.
Okay. Next, sun exposure will treat acne. Is this a myth or is
No. In fact, sun exposure could aggravate your acne. And in fact, if you're treating your skin for acne, yung skin cells mo, di ba, parang na-mention ko kanina, it becomes more vulnerable. Mas sensitive siya sa effects ng rays of the sun. So,
oh,
you have to use sunscreen as well.
okay. Next, lack of sleep leads to pimples.
Yes, definitely.
Oh, yeah,
Because
you
it means
mentioned
that when you're deprived of sleep, it means you're under stress or you didn't have enough length of sleep. So yes, it does lead to production of tigidig pimples.
okay.
Naalala ko lang kasi 'di ba kanina pinag-usapan tigidig yung tawag nila doon.
And mention mo nga talaga doon kanina na oo, yung lack of sleep eh. Yeah. Okay, last one. Applying more cleanser will make acne go away.
No. Uh, the recommendation is you cleanse your face. It could be a mild cleanser or that's one that's with medication 2 times a day lang. Kasi overuse of facial cleansers could also trigger your acne. Ang acne kasi, it does not only occur sa mga oily skin. When you have very dry skin, nagkakaroon ka rin ng acne. So, you don't have to wash your face as often as you can. As much as possible, 2 times a day lang. Once in the morning and once at night before you retire to sleep. In the middle of the day, if it's kunyari talagang mainit, maalinsangan, you can wash your face lang with cold water, pero hindi naman kailangang meron ding sabon kasi it could deplete your skin of the protective oil din na kailangan ng skin mo.
Alright.
So, it does not mean that the more you wash your face, the less acne you'll have. Hindi rin naman. Yung recommendation lang, it's 2 times a day or at the most 3 times a day.
Alright. Thank you so much, Doc Ola. Alam mo, nag-enjoy talaga ako sa session.
Nako, thank you. Finally, ang tagal nating na-set tong ano na to. Excited din. Kaya lang kung siguro some other days natin nagawa, baka gulo-gulo.
So, Doc Ola, for patients who want to reach you, how can they reach you?
Yes, actually Mondays to Fridays, I'm at the Southern Isabela Medical Center, Department of Dermatology and Venereology. We actually have our dermatology center there, and we have a lot an array of treatments if you have for your dermatological needs. Hindi lang acne, actually, marami po. We have a wide range of services for your needs, not just the aesthetic po ha, but your pathologic diseases. We cater to them. And on Saturdays pala, Saturday sa Matbay Private Clinic at the Heritage Building, Room 216, every Saturday afternoon lang po. And if you have quite urgent needs, and would prefer to have an online consult first, you're free to check out the Facebook page of our department. Just type in at SIMC, capital letters SIMC, capital letter D, and then small letters ERMA for our page. And we would gladly answer your queries, your teledermatology questions. So that's at SIMC Derma. That's our page.
All right. Thank you, Doc Ola, again.
Thank you, Tin.
Bye.